All right. Hey, everyone. My name is Vanessa Collins. I will be your moderator for this session. This is for MBC, Practical Matters and Creating a Plan, with our presenter, Monica Bryant. Monica is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on healthcare-related issues. She is the co-founder and COO of Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers.
Thank you so much, Vanessa, and thank you all for joining us today. There we go. So because we only have a little bit of time together today, I just want to tell you a little bit about Triage Cancer so that if after today you have questions about what I've talked about today or about some of the other topics that Triage Cancer deals with, you know that we can be a resource to you as well as YSC. So as Vanessa mentioned, we are a national nonprofit that provides education on all of the legal and practical issues that arise after a cancer diagnosis. And we do that in a couple of different ways. We participate and host events all over the country. We are going back to some in person this year, but still have plenty virtually, including our Triage Cancer conferences and our monthly webinars. We also have a robust website with tools and resources that can be downloaded, and animated videos and state-specific and local-specific resources, as well as a legal and financial navigation program, which I'll tell you about sort of at the end of today. So you'll see throughout the presentation where I point you to some of our resources specific to today's topic. But again, please know that we can be a resource for you moving forward. So when I was asked to come talk about preparation, I sort of chuckled because I was like, well, I don't really talk about preparation. And then I started thinking about it and realized that actually everything I talk about is really about being prepared. And I think that there are some sort of large categories of our lives where it is incredibly important to get prepared, particularly after a serious medical diagnosis. And so today we're going to touch on how to get prepared at work, how to get prepared around health insurance issues, around finances and medical decision-making and estate planning, and then some really practical places or ideas where you may be able to get some help with sort of the day-to-day things that are going on. And when you're thinking about, okay, why do I prepare? There's so many reasons, and some of these may or may not resonate with you, but I think first and foremost, preparation is necessary for you to get what you need. You don't prepare if you don't know what's available to you. How are you going to get the things that you need? There are probably thousands of studies that talk about how decreasing stress increases health. There are also quite a few studies that talk about how things like organization and decluttering and preparing and planning ahead are all things that help decrease stress. So in a nutshell, preparing and organizing and kind of getting your ducks in a row, ultimately, it's going to help improve health too. Certainly, there are some financial reasons why preparation is so important. And then, of course, it's helpful to protect the people around you, whether that's your family or your friends or whoever your community is. These preparation pieces are going to be helpful for them as well. So getting into it, we're going to start off talking about work, but I did just want to mention that a lot of these concepts and laws and protections and tools are also available in the housing context and in the school context. So I don't know if any of you are still in school or interested in maybe going back to school or having issues around housing. But even though we're not going to talk about those things today, we do have resources on triagecancer.org for you. So when we think about work and what might be available to us at work, there are a couple of places where you can go to find out what your rights are and what tools may be available to you. So there are fair employment laws, both federal and state, that are going to provide protection from discrimination. based on your diagnosis, but also are going to provide a tool called a reasonable accommodation, which we'll talk about in just a minute. There are also federal and state leave laws that can provide options to take either short amounts of time off or longer amounts of time off. And then if you are an employee that's working under an employment contract or are a member of a union, those contracts or collective bargaining agreements may provide additional rights or benefits. So when we're talking about getting prepared and planning, understanding what things are available to you, what tools are in your toolbox, whether you need them right now or you might need them in the future, is helpful. But we often forget that the law is just the bare minimum of what employers are required to provide. And many employers are in fact much more generous than that bare minimum. So looking to an employer's specific policies or procedures is going to also be very helpful. So not just looking to the law. What are some things you're going to want to look for? Well, what benefits are being offered? Most of us will kind of know what our health insurance benefits are through a job, but I can't tell you how many times we've asked people, well, do you have access to disability insurance through your job? And they say, no, I don't think I have that. And then they go back to their employer and find out that there is a disability insurance policy or even a limited life insurance policy available to them through their work. There may also be some other benefits. Sick time, vacation time. Does your employer allow other employees to donate hours that you can draw from? Is there an employee assistance program available to you that might be helpful to meet some of your needs? Some employers have things like daycare centers or transportation stipends. So even if maybe you don't need that transportation card, to get to and from work, maybe it can be helpful to get to treatment or for other reasons. And then many employers will also lay out a process for asking for medical leave or asking for a reasonable accommodation. And so if you don't know if your employer has any of these things or has a process laid out, there are a couple of places that you might want to look to find out. So some employers have a policy and procedures document or an employee handbook that they lay all of this out in. Certainly some employers aren't that formal, so you could ask colleagues, you could ask whomever at your job deals with benefits. Who do you turn your timesheet into? Maybe that's the person you can ask. I strongly recommend that you figure out what's available to you at work before, hopefully, you need those benefits. So I often talk to people who are in the midst of trying to figure out how to take time off because their surgery is coming up or they're just not feeling well and they don't know what to do, and not being prepared and knowing what's available to them increases the stress and anxiety around all of this, which is already too stressful. Now, I mentioned reasonable accommodations, and I just want to talk about them briefly and remind you that we have tons of information on our website about them. But reasonable accommodations are a tool under the ADA and state fair employment laws that are incredibly helpful if you're trying to continue working, if you're maybe trying to return to work, or if you need to take some time off. And they're really anything that allows you to be an effective employee. So we sort of categorize them into 3 different categories. Some are about space. It could be about special furniture. Maybe it's about telecommuting, which has definitely become a hot topic of conversation around the pandemic and individuals who may be immunocompromised. It could also be about schedule. And so I definitely hear from people that they could continue to work, but for the fact that their side effects are worse at night or worse in the morning, or they have appointments in the afternoon. And so adjusting schedule might be a reasonable accommodation. And then the last category is sort of everything else. And I wanted to stop and talk about this because I know, particularly for individuals in the metastatic community that I speak with, working as long as they can is incredibly important to them. And so I want to give you information about all of the possible tools if that is also one of your goals. But of course, that's not the only tool to deal with the side effects of treatment or the cancer itself. And so in addition to the legal tools and the policies that your employer might have, certainly talking with your healthcare team about what else exists. So is there medication? Are there complementary therapies that can be helpful? And then we're going to talk a lot today about the practical tips. Now, if you are in a place where you can no longer work, you may want to look to see what your options are to replace that income. And one option is disability insurance. There are multiple places you might be able to get disability insurance, including a private policy, maybe that you have through your job. Some states have state disability insurance programs that are short-term programs. And then, of course, there are the 2 federal programs run through the Social Security Administration. And if you are interested in learning more about disability insurance, I invite you to take a look at our website under resources by topic. And we have a whole page dedicated to disability insurance. Now, another place where I think people need to get prepared and really understand what their options are is around health insurance. Most of the time when I'm talking with people, particularly when I'm talking with people around access to care, so being able to see the doctors that they want to see, or financial concerns, it comes back, at least a piece of it comes back to health insurance. And in order to be an effective consumer of health insurance, we have to understand the terms. So these are the terms specifically related to costs. Just to have health insurance, you have to pay a monthly premium. And that's going to be a fixed dollar amount, and you're going to pay that every single month, whether you go to the doctor or not. But then there are some added costs when you actually go and use your health insurance. The first is an annual deductible. Again, this is a fixed dollar amount. It's going to vary by plan, but it's what you have to pay first before your health insurance policy starts picking up their share of the cost. Their share of the cost is referred to as cost share or coinsurance. And this is a percentage. So you could have a plan that has an 80-20 cost share, which means once you've met your deductible, your insurance company is responsible for 80% of your healthcare costs, and you're responsible for 20%. Now, many plans also have an additional payment called a copayment. This copayment, again, is a fixed dollar amount that's going to vary from plan to plan and potentially from service to service. So you could have a policy that has a $25 copayment just to see the doctor, or a $35 copayment to see a specialist, or a $250 copayment to go to the emergency room. But one of the most important things I think we all need to understand about our health insurance is the out-of-pocket maximum. And this is, again, a fixed dollar amount that's going to vary from plan to plan. But what it represents is the most that you're going to pay out of pocket for your healthcare per year. And the way you get to that out-of-pocket maximum is a math problem. So you add up everything you pay towards your deductible, everything you pay towards your copayments, and everything you pay towards your coinsurance. So it's literally everything you're paying out of pocket except those monthly premiums. So here's an example of how this works and why it's important. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80-20 coinsurance, and it has an $8,000 out-of-pocket maximum. Dan hasn't used any medical care up to this point in the year, but he gets into a car accident, spends a week in the hospital, and ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, the first thing we always pay is that deductible. He pays his $2,000, leaving $100,000 left of the bill. His plan has a coinsurance amount of 20%. 20% of $100,000 is $20,000. But does Dan have to pay that full $20,000? I see some shaking heads. No, that's correct. Because he has an out-of-pocket maximum, he only has to pay $6,000 of that $20,000 to reach his out-of-pocket maximum. And then the insurance company covers the rest of that bill and all the rest of his health care for the year ahead. This is not to say that $8,000 isn't a lot of money. Of course it is. But when we start looking at the alternative, if he didn't have the out-of-pocket maximum, or certainly if he didn't have health insurance, $8,000 starts to feel a little bit more reasonable. It also, by understanding this and how the out-of-pocket maximum works, allows us to plan ahead for a worst case scenario. It's also incredibly important when we're going to pick our health insurance policy for the next year. So if you would like to hear any of that again, the terms that I just went over, or this example, or there are people in your life you think could benefit from understanding this, all of that is included in one of our animated videos on health insurance basics. Now, one of the challenges, there are many challenges with health insurance, but one of the challenges is that picking a plan isn't a one-time chore. It's actually something that we need to do every single year, regardless of where we get our health insurance. And that's for a couple of different reasons. So certainly our needs could change. So maybe mid-year your treatment plan changed and now you're on a different medication that's not covered under the current policy. Or maybe now you want to go see a different specialist and that specialist isn't included in the network of your existing plan. Maybe you're moving. There are all sorts of reasons why you might need a different health insurance option. But even if you're confident that you don't, what's available to you could be different each year. So it is really helpful to check what's available to you every single year and do an assessment of if the plan you have is meeting your needs and is the most cost effective. And we have some tools on our website to help you do that, including an animated video on picking a plan and a health insurance worksheet that walks you through how to figure out what the plan is actually going to cost you by year end. And both of those are available on our website. Now, even if you've picked the most perfect plan for you and you've done all your homework, once you actually receive care, you're going to get a number of communications. You're going to, from the health insurance company, probably get at least 2, if not 3 different communications. These could be snail mail, these could be email, this could be a portal, could be, hey, we've gotten a claim, now we're processing it. And then finally, you're going to get the explanation of benefits. Now, every EOB looks different from every company, but they should have a bare minimum amount of information. The telltale sign of an EOB is somewhere on it, it says this is not a bill. Then it's going to have some information about the policy, how much was billed, how much was covered. And then there's going to be some information about the services included in this EOB. Now, a good EOB might even have words in this section, but many of them just have these codes. And so you may have to do additional digging to figure out what this EOB is for. In addition to what services you got, you're going to get some information about what the health insurance company is going to cover and what you're responsible for. Again, a really good EOB might also give you some information about how much you've paid towards your deductible and how much you've paid towards your out-of-pocket maximum. This is really helpful to understand and pay attention to because we hear stories all the time of people going in to see their doctor and the front desk people saying, okay, we need our $35 copayment. If you understand how the out-of-pocket maximums work, then you can be empowered to say, you know what, I've already hit my out-of-pocket maximum. I don't need to pay this right now. And if they give you pushback, you can always say, you can bill me for the copay, but I'm quite certain I won't owe it given that I've met my out-of-pocket maximum. So it's just another place where we can be informed consumers. Now, the last piece of information is going to be the bill, and that's going to be from the provider themselves. That could be the hospital or the lab or the doctor, the imaging center. The challenge, though, is that the communications don't always arrive in this order. Providers are often much faster at sending the bill than the insurance company is at processing the claim. And so if you get a bill and pay it right away before you've seen the EOB, you may end up paying the provider more than they actually are entitled to. And now you're in a position of trying to get money back from a provider. So the general rule of thumb is to wait until you get the EOB to pay the bill. But this can't happen in a vacuum. If you've received a bill from the provider and you haven't gotten the EOB and the due date is coming up on that bill, make sure that you're communicating with the provider to say, hey, I got your bill, but I still haven't gotten an EOB. Can you push back the due date? Or can you make a note in my file? I've been doing this a long time and I've yet to ever hear of a problem with that. I also think that this is a really opportune place for family and friends to chip in and help out. So, you know, the dreaded, let me know if there's anything I can do to help. Okay, well, you know what you can do to help me? You can go through that pile of mail over there. You can open up all the envelopes, throw away all the junk, and match the EOBs to the correct bill and staple them together so that now all I have to do, the only place I need to expend energy is by going through a very nice, neat stack of bills and paying what I now know that I owe. It sounds simplistic, but certainly the more complicated your treatment is, this can get really overwhelming really quickly. If you've received an EOB and the insurance company has either not paid as much as you think they should pay, or they've denied a claim outright, we as consumers have the right to appeal that decision. And I have to tell you that appeals is one of those soapbox issues for us at Triage Cancer, because we know that millions of claims are being denied every single year, but somewhere between 40 and 60% of all of those denied claims that get appealed get ruled in favor of the patient. And so when we're talking about financial toxicity and the financial stressors, people paying bills that they shouldn't be paying is certainly adding to that. And so appeals is the place where we can rectify that situation. But it's one more thing to put on the shoulders of individuals who are coping with the cancer diagnosis and their family members. The trick with appeals is, one of the tricks with appeals is staying organized. And that can be easier said than done, because again, it's not happening in a vacuum. You know, I often say the Post-it note method of keeping track of the conversations and the names and where things are and what you need to do is never really a good idea. We do at Triage Cancer have a health insurance appeals tracking form, which is just one way to organize the information. But you're going to want to keep track of who you spoke with, the summaries of those conversations, any important dates, when you think you're supposed to get a response from somebody. Now, I think this is another opportunity for those friends and family that, you know, start off with, you know, let me know if there's anything you need or if I can be helpful. Sure, you know, it can be helpful. Can you sit on the phone with me while I call my insurance company to get the details that I need and take notes? So that then all you have to focus on is having the conversation. We need to stay organized when it comes to the actual medical information as well. And I think there's lots of different strategies here. It's really about finding what works for you and for the people around you. One thing, you know, that I do is I have an email folder where I keep all the medical information for myself. So when I get blood work, I ask for the results to be emailed to me as well as to the provider, and then I just file it in that folder. If I've communicated with a billing department or with an insurance company via email, I will file that in that folder so that when I'm looking for that information, it's all in one place. I also think it can be really helpful to email yourself a list of medications, including dosages, frequencies, you know, where you get the medication. So is it something that you need to get from a specialty pharmacy? I also think it can be really helpful to maybe email that list to a caregiver as well, so that if someone is coming with you to appointments, they have that on the ready. I know one of my pet peeves is every new provider you see, you have to write down the list of medications that you're taking. And I always think to myself, we have electronic medical records. Can't you pull that up? But inevitably, I have to write it all down. So you could hand that clipboard to somebody else to do that legwork. It can also be really helpful to keep a list of your provider's contact information in your phone as well. Another thing that I think I hear a lot actually is I have all these questions for my provider between appointments. And then I get into the appointment and my mind goes blank. We start talking about other things, and I forget to mention or ask the questions that I have. So a strategy, again, that I utilize is I use an iPhone, and the doctor's appointment is in my calendar. And in the notes section of that calendar, I just keep a running list of questions that I have. As soon as it pops into my head, I pull out my phone, I write the question down. And I literally am sitting on the table, with my phone open to that list of questions so that I can remember to ask them all. I also think it's really helpful to take pictures of your insurance cards. So if you ever forget your wallet, you have them right there. Some people are concerned about keeping this kind of information sort of in an unsecured location, like an email folder, which I can completely understand. There are paid services, and these are just a few examples, where there's extra sort of encryption and security on it as well, but sort of function in the same way as an email file or a file folder, for example. So again, just some suggestions. I'm not necessarily endorsing any of those. I think there are some other useful tools. So many of us have smartphones, and those smartphones have capabilities to include emergency contact information, notes about medications that you're taking. You can even write about the existence of any sort of advanced planning documents you might have. If you head on over to my next session on estate planning, you'll hear more about this. There are also options to make sure that that information is always with you, like medical jewelry. I've seen some really nice ones lately, because I think some people have told me that those bracelets feel outdated to them. And so this, Apple Watch band is just one example of that. When we're talking about staying organized, in addition to the employment and health insurance and medical information, there's also a whole bunch of financial information you're going to have to deal with. And I can tell you right now, that is not a good organizational system. So what is? File folders, 3-ring binders, electronic files. There are pre-built planners that you can buy on Amazon. There are lock boxes that you can carry with you. It doesn't really matter. What matters is picking a system that makes sense to you in terms of how you like to organize things, and then one that you can keep up, I think is really, really important. We have 2 webinars that were done for us by a certified organizer on our website. And one of them is called Drowning in Documents. And really, I feel like it should be required viewing for all of us, particularly if you feel like you have too much paper in your life. But why is keeping this financial information so important, particularly after a cancer diagnosis? It's because these types of financial documents are going to matter if you have to file an appeal, if you need to prove that you have certain coverage, and they could also, particularly if they're around unreimbursed expenses like transportation or meals or lodging around your healthcare, those expenses could also be tax deductible. But you have to keep those records in order to access that benefit. One quick note on taxes. Occasionally I will hear from people who are no longer working and who maybe are receiving only disability benefits. Do I really need to file taxes? I'm not even earning, above the threshold. Is filing taxes important? And it depends, but it could be, particularly if you could have access to certain credits. So there's a general rule of thumb that even if you aren't required to file based on your income level, it could still be beneficial. And there are free services or very low cost services to be able to do that, particularly if you have a sort of simple financial situation. Now, lists are your friends. I think lists are incredibly important, not just for the organizational factor, but creating them and putting the things that are swirling around in your head down on paper or electronically, however you do it, can be very cathartic. It can also be paramount to caregivers in order to be the best caregiver. And so we talked a little bit about keeping a list of medications so that you have it when you go to the doctor's office, but this is also going to be important for caregivers if they are helping you navigate anything related to medications or treatment. It's very helpful to also have the contact information of pretty much everybody that you interact with in an accessible location. I am certainly guilty of the fact that pretty much everybody I know I have in my phone, but if my husband needed to access who my doctor was, he would have a very hard time figuring out who that was. So creating a list, very simple, of your providers, names, phone numbers, and why you see them, other professionals that you interact with, accountants, lawyers, do you have an insurance broker? If you are close with your religious leaders, or if you have children, the people that interact with your children, tutors, coaches, principals, all of that information should be on a piece of paper somewhere. It's also helpful to list any legal documents that you might have. So even if you don't want to share the actual documents widely, making sure that people know if you have a life insurance policy or if you have a will or an advanced healthcare directive in a obvious location for anyone who might need it. And then certainly accounts and financial information. And this piece isn't necessarily something that you need to keep publicly available, but someone should know that there's a comprehensive list somewhere. And there's lots of different ways to do this. This is one example. We refer to this as our financial big picture document. It's downloadable on our website. It's a Google Sheet or an Excel document. And it's an opportunity to list any assets you might have. So houses, cars, bank accounts, retirement accounts, emergency funds. It's also a place for you to list any debts that you might have. So school loans, car loan, mortgage, medical debt. But then there's also a place for you to include the account numbers, the login information. Do you have a person that you deal with at that particular bank? Are there notes that somebody needs to know? This financial big picture document is helpful, I think, again, just sort of for everybody to make sure that they're organized. But particularly if someone needs to step in and help you manage any of your finances, they're going to need this information. And having it all in one place can be very helpful. When I talk with individuals who are in cancer treatment and are struggling sort of with the stress of it all, a lot of times the practical pieces around even paying bills is the thing that kind of pushes them over the edge. And so there are lots of ways to deal with that. I think the name of the game is to streamline and simplify. So that could be a lot of different things. Setting up automatic bill pay so that you don't even have to worry about it. It just happens every month. I tend to use my bank's online banking system so that if I'm like, wait, did I pay the water bill? I don't know if I paid the water. Did I pay the? I just log in and there I can see that I paid it on what date. I think you haven't figured out already, lists and spreadsheets are a thing for me. Spreadsheets, checklists, super helpful when it comes to bills as well. So setting up a checklist of every single bill that you have to pay, when it's due, generally how much it is. And then as you pay them, you just check it off. And then it becomes really easy to just go down the list and see if any checks are missing to figure out what you need to do. But even with those tools, you may still need more help for a number of reasons. It could just be, this is the thing you don't want to deal with because you're dealing with your health and all the other things that come with this diagnosis. You may want to consider appointing a financial power of attorney. And that's an estate planning tool that I'll talk a lot about in the estate planning section, but it's essentially where you name an agent that has the power to make financial decisions for you, like paying bills. Of course, there are other estate planning topics that I think could be really helpful, but I'll cover those in the next section. If you decide not to come to my breakout, certainly know that these resources are all available for you on our website, including an entire video series that talks about each part of an estate plan. Now, getting others involved can sometimes be a double-edged sword, but it's usually really helpful. And many people that I talk to sort of have an army ready to help, but they may not know how to provide that help. And unfortunately, I hear a lot that figuring out how others can be helpful does fall on your shoulders, and that's hard. That being said, there may be some tools that can help you, or certainly help, your loved ones ease the burden a little bit and still make sure that you're able to access the help that you need. And so for things like the everyday meals, transportation, errands, yard work, housework, there are a couple of different tools out there. Meal Train is a really common one where it can be set up, and then whatever community we're talking about can sign up for days if they're going to bring meals. Care Calendar, I think, is a really helpful tool in that it's not just about meals, but it can also just be like who's going to come and hang out with you for the day. My Lifeline and Caring Bridge are two additional tools that sort of are big in the cancer community. Caring Bridge also has a I don't want to say social aspect to it, but you have the opportunity to create a profile, and then it's a way for you to share with your community anything you want to share, what's going on with you, any updates, but it's more locked down and private than, say, Facebook. There's also a nonprofit called Cleaning for a Reason that does provide individuals who are in active cancer treatment with free house cleaning services. So while some of these things require you to sort of have an army already, there are some that you can just apply for to get that assistance. I recently was talking with a young woman who was in the midst of active cancer treatment, and she was really struggling in this space because she had recently moved to a new city. She really didn't have very many people local to help her, and her family and friends back home were trying to figure out how they could be helpful. And we did a lot of brainstorming, and what we basically came up with was she created some Amazon lists of things that would be really helpful for her, and people were able to just buy them off the Amazon list and they showed up at her house. She also was able to sign up for a joint meal planner where there could be multiple users, and she would pick meals that looked good to her, and then her loved ones could actually use things like Amazon Fresh or Whole Foods delivery to get all of the ingredients delivered to her. So it didn't solve the who's going to make it problem, but it at least solved the not having to go out to the grocery store and get all the ingredients. She also said that she kind of preferred it to the idea of Meal Train because she was getting to eat the things she wanted to be eating. So even when your army isn't physically near you, there are ways now with technology that they may be able to be helpful. Now, for caregivers staying organized, I think there are lots of different tools as well. I think command stations are incredibly useful. And you remember those lists I suggested? Those lists should end up on the command station. Now, there are electronic versions. You can just use a Google Calendar, which is totally free, a whiteboard. You can use a piece of paper and a clipboard. It doesn't matter, but it's about having a centralized location for all of this information to live, so that the people in your space who are trying to help you and provide care for you know exactly where to go to find what they need to provide you with that help. We also know that when there are multiple caregivers, things as simple as a group text string can be really helpful, or a group email that everybody is on to communicate. And then I also think something that's really helpful, both potentially for you and for the people who are trying to help you, is a go bag. So having a bag and different bags for your various things. For example, having a bag that you always take with you to doctor's appointments, and whatever you need at a doctor's appointment in that bag. So do your feet always get cold in the exam room? Pair of socks is always in that bag. A pen, a notebook, whatever files you need, hand sanitizer and a mask, right? And they're always in there. If the mask gets washed, as soon as it comes out of the washing machine, it goes back in that bag. And I was talking to somebody about this and they laughed and they said, it reminds me about having a diaper bag when I had little kids. And I thought, that's exactly what it is. Because this way, on the day of your appointment, you pick up that bag and you go. And you're not worried about, do I have all the things that I need? Am I going to forget something? What else should I be bringing with me? You don't get to the appointment and think, crap, I don't have the notebook that I take all my notes in, or I don't have the socks that I want. So it's about finding ways to plan ahead that help to decrease the stress and again, give you what it is that you need. Now, childcare is something else that I hear from a lot of people in active treatment that's really challenging. And so there are a couple of resources I just wanted to share with you. There are some new tools that have popped up over the last couple of years to help parents find childcare. So it doesn't help dealing with the cost of childcare, of course, but sometimes it's about, I just need somebody reliable. And so these are a couple of different tools that I've played around with that I think are kind of useful. I think Mommy is a really cool one because it actually connects you with people local to you that also are looking for childcare. So you could potentially share a babysitter or a nanny if that's what you're looking for. And you can even filter it by location or animal, like, not having any animals or age of children, excuse me. And then I think also looking local. So do you have a neighbor, high school student that can come over for a couple of hours in the afternoon and play with your kids so that you can rest? Local Facebook groups is a fantastic resource. And there's a pretty cool app called Carpool Kids, where you essentially can connect with those around you. Maybe it's other families on your kids' sports teams or at school, and you can everyone puts in their kids' schedules and their needs for rides. And then the system helps match you up with, well, who else is going to those places? And so you can kind of just click on it and say like, okay, can you take, my kid with you when you go there? I never knew about this tool, but I think that it could be incredibly helpful when you're looking to sort of organize the help that you are being offered.
Monica, we have about a minute left till we have to close this out.
No problem. Does anyone have questions? Well, I just want to say really quickly then, if anyone does have questions about any of this or any of the other things that Triage Cancer does, our legal and financial navigation program provides confidential one-on-one help for individuals who've been diagnosed, caregivers, or healthcare professionals. We don't provide legal representation, but what we do is sort of take a look at your situation and then give you the answers that you need and the next steps for you to take. And so this is a relatively new service that we are promoting. And to utilize it, all you have to do is go to our website at triagecancer.org/get-help and fill out an intake form, and then we set up a phone call. So
there is a question about if the group can get a copy of the slides that were presented. Is that possible?
Sure. Yeah, we'll make that happen. I'll work with Megan on that.
Okay. So for anybody that is in the chat, the next thing up is at 3:30 is the wellness activity, adaptive yoga and mindful self-compassion for well-being. And then if you haven't checked out the exhibitors, the exhibit hall, definitely do that. There's a scavenger hunt. If you participate, you can win one of 3 $50 gift cards to Uber Eats. So take advantage of that. And then take advantage of chatting with everybody in the chats as well, guys. Thank you, Monica, for everything. I think this is a lot of information for everyone to digest.